I'm here with Dr. Jeffrey Cohen, who is Instructor of Psychology in the Department of Psychiatry at Columbia University Medical Center. He teaches undergraduate students in the Department of Psychology at Columbia University. His research has been published in peer-reviewed journals, including Behavior Therapy and Journal of Anxiety Disorders, and presented at the annual convention of the American Psychological Association and Association for Psychological Science. He is committed to educating the public about the value of psychological science. He has been interviewed by NBC, Medscape, Men's Health, Reader's Digest, Prevention, and now me. So I like to start with saying where we are today, and the world has 1.528 million cases. 23,405 of those are new cases. And the total deaths are 91,664. In the US, we have 5 million. So that's in the United States. Okay. Worldwide, it's 5,131,000. And deaths are 331,109. So when I first spoke to Jeff, we said that COVID-19 is not a disease. It's not a mental illness. It's a disease, but it's not a mental illness. So I guess anxiety is normal. What is causing all the anxiety besides the fact that you can get a disease that can kill you? Is it the uncertainty? Is it the questions about, is it safe to go out? Is it the isolation? What do you think is causing the anxiety?
Anxiety, I'd say, is a normal response to the COVID-19 pandemic. Like all emotions, we have anxiety for a reason. So anxiety helps us prepare for a threat, such as the threat posed to our health by COVID-19. So it's the anxiety that motivates us to take the steps to be safe, such as practicing social distancing, washing our hands, wearing masks. So in that sense, anxiety has a very helpful purpose.
Okay. So there's a headline I found, it said, psychiatrists fear a tsunami of mental illness after the lockdown. And they said they had seen a 43% rise in urgent cases, while 43% reported a reduction in routine appointments. And they say that in old age psychiatry, our patients seem to have evaporated. I think people are too fearful to seek help. So I know you told me that you're talking to people all day long.
All day long.
Via Zoom or via some secure website, but it's all, nobody's coming to your office, right?
I'm not seeing people in person. There would really need to be a clinical indication to provide in-person care. And in those cases, we're certainly thinking about how to do that. But I don't have any patients that need to be seen in person at this time.
Okay. The other thing people have talked about is that rampant unemployment. The unemployment figures are close to 15%. Isolation and uncertain future could lead to 75,000 deaths from drug or alcohol abuse, as well as suicide. I've had family members saying that it's time to open up, despite the fact that the virus hasn't gone away, that you've heard President Trump saying that you can't make the cure worse than the disease. And so what do you tell people when we know the science says, this will keep spreading if we don't keep social distancing? What do you tell people that I can't pay my bills? I am locked, either I'm isolated or in my case, I live alone. But speaking to my daughter, she said, I wish my husband was going to work. I said, I wish my 2-year-old was in her preschool. I wish I had my cleaning lady back. I'm going nuts with all these people in the house. So there's quite a variation. And so what are the typical things that people come to you to talk about?
So I specialize in treating anxiety and regulating emotions and using research supported psychotherapies to do that. So specifically mindfulness-based techniques and cognitive behavioral techniques, which help us change anxious thoughts and behaviors into more helpful thoughts and behaviors, and I think are particularly useful strategies in the midst of COVID.
Okay, so if I call you up and said, I'm not sleeping at night, what do you recommend?
Yeah, so insomnia. There is the gold standard treatment for insomnia would probably be cognitive behavior therapy for insomnia. And we would start to talk about sleep hygiene. And so what is sleep hygiene? So it involves a few things. The first is you only want to use your bed for sleep or for sex. Why is that? Because we do not want your brain to pair the bed with other activities. We'd also recommend you maintain a regular sleep schedule, even on weekends. So going to bed at the same time and waking at the same time each day. Typically 7 to 9 hours is the recommendation for adults. And so you could work with a therapist on really developing those sleep hygiene skills. An alternative and also effective treatment approach would be medication management. And so you could certainly see a psychiatrist who could prescribe.
You know, like Lunesta or something like that?
Sure.
Okay. So what about people who just said, I can't deal with it? You know, do you have people calling you who just said, I'm freaking out, I can't stand it, I want to go outside, I can't handle being inside anymore?
Yes, so it's certainly stressful. The stay-at-home order is certainly stressful for many people. And people who are staying at home might feel lonely. It's very understandable to feel lonely, very understandable to feel isolated. And so it can be helpful in those cases to think about how to maintain connection with loved ones, whether it's through video chats or FaceTime or even standard phone calls. That can certainly be helpful. Also maintaining schedules during the day. So taking a shower in the morning, setting aside a place in your home where you work. Remembering to take regular breaks, remembering to take vacations, even in the midst of a pandemic, to take days off. So certainly maintaining a regular schedule and reaching out to loved ones and friends can be helpful when people do feel the stress of the stay at home.
Okay. Should people be watching television?
Yeah, that's a great question. So it's certainly useful to pay attention to the news that benefits you, that keeps you safe. However, a constant stream of COVID-related news is likely enough to make anybody feel anxious, particularly from less reliable sources like social media that tend to contain misinformation. So I typically would recommend to watch the news once, maybe twice a day, and pay attention to the news you need to keep you safe.
What is the news that you need to keep you safe?
So if you're living in New York, maybe that's the news that you can find on New York One on your local channel that helps you stay abreast of what the best guidance is. Also, maybe looking at the CDC website.
Okay. So today I was watching MSNBC and I've never seen Katie Tour, and I said, they look stressed out and they look tired. And I guess because they're reporting on the news all day. I mean, she was talking about Michigan, which besides COVID-19 has record flooding. And people are also worried about their meat shortages. So how do you deal with people who say, I don't want to go to the grocery store, I need to go to the grocery store, I can't, you know, I'm trying to get Amazon or Instacart or something to deliver and they're not delivering. How do people do, how do you help people make those decisions? Should I go to the grocery store? Should I go to the pharmacy? My pharmacy won't deliver anymore. Yeah, so you have to go. How do you ease the stress of people? You know, and some people just they like to go to the grocery store and pick out what they want. So I mean, you can't say, you know, so.
So it can be really helpful to recognize the limits of what is in your control and what is not in your control. Okay. So within our control can be how much time we spend reading the news, our own health, our hygiene behaviors, how much we check on loved ones. It's helpful to realize that beyond the scope of our control are things like the global economy, how soon we have a vaccine, and other people's behavior.
So So I think that a lot of people have the question, I need to go to my doctor. I don't feel well, but I'm afraid to go to my doctor. Like I have a doctor who's in a hospital. They said, "Do you want to come?" And I said, "Not really. You're treating COVID-19 patients. It's not an emergency." But sometimes you do have to go to a doctor, and then they worry about, okay, I guess I got to take the elevator. I mean, my doctor said, well, I'm going for like a routine checkup, and she said, so when you get there, you will call us before you get there, and when you're in the elevator, we will escort you into a patient room, so you won't be in a waiting room. So I imagine my first blood pressure reading is going to be a lot higher because of all this. And so, I mean, so how do people make decisions? Because it's hard to make decisions. That's what I find. It's hard to make, you decide, I'd like to take a vacation, but I don't have a car, and I'm not sure I want to go on the railroad. I'm not sure I want to take some people they're afraid to take Lyfts or Ubers because who knows who was the last person in there. And so how do you deal with all these decisions that you have to make every day? And also just when you go outside, you have to remember, I've gone outside and I forgot my mask, so I have to go back and get it. And all these things.
Yeah, so how do you make decisions? So as you might notice, the mind is continually producing thoughts.
Right.
And so we can use skills that come from mindfulness, which is to observe thoughts as thoughts. And we can use skills like writing down pros and cons. So it's easy to sort of get lost in a rabbit hole of worry where you're going from thought to thought to thought. And so in this type of scenario, what could be helpful is to make a list of the pros and to make a list of the cons, and then kind of look at your list and consult your intuition, your sense of inner wisdom, and let that be your guide.
So there are some apps that people can use. We talk about some of them. Why don't you talk about them?
So I would certainly recommend COVID Coach, which is free from the United States government, was developed by the Department of Veterans Affairs, which is a leader of psychological research in this country. And that includes mindfulness, which is just the practice of paying attention to the present moment, including to things we're already doing, such as the food we're eating, the conversation we're having, as well as mindfulness can also include meditation, which is to set aside a period of time ranging from a few moments to much longer to do nothing but meditate. So mindfulness, which is to be aware, is part of COVID Coach. It also includes cognitive skills, which can help us evaluate the helpfulness or the accuracy of our thoughts, and also behavioral skills. So helping us understand if our behaviors are helpful or harmful.
What are cognitive skills?
So cognitive skills, one, allow us to see thoughts as thoughts, and then allow us to evaluate the evidence for or the accuracy of a thought. So it turns out we often think that every thought is a fact. In fact, it's not. It's simply a thought the mind is producing. And so if we can gain distance from our thoughts and see them as thoughts through cognitive work, we can start to get in touch with reality as it is versus the story we're telling ourselves.
So what about transcendental meditation?
So there's not a lot of data behind transcendental meditation because that is to clear the mind. And it actually turns out that suppression is not an effective behavioral or emotion regulation strategy. Mindfulness, where we are paying attention to what is in our mind or what is outside of us, basically becoming aware, is much more effective than trying to clear or suppress. So that is actually one I would not recommend.
Okay. Okay, and the other one is Headspace, which has been around a long time.
Yeah, Headspace is a great app that also focuses on mindfulness-based principles around becoming aware of ourselves, what surrounds us, what are our emotions, what are our thoughts, what are we feeling. Mindfulness can give us a space to choose how to act versus just reacting.
Okay, so I know Norman Cousins was diagnosed with cancer. He decided to watch the Marx Brothers, Woody Allen, the Three Stooges, whatever he liked doing, and he said that helped him. I mean, so do you recommend people just to turn off and, the news and just watch, like Die Hard or Star Wars or something like that?
So distraction can certainly be a helpful technique, certainly in the face of a crisis and a pandemic. Sometimes we do need to just shut off and watch, reality TV or whatever it is. It's just important to be mindful that if we're distracting all day, every day, we may not get to the life that we want to be living, and other tasks may fall by the wayside. So I think distraction works in small doses.
So I thought that during this time, I'd be cleaning out closets, getting my apartment in order, going through my clothes and getting rid of things. And I realized I don't like doing those things. And I decided, okay, first of all, I don't even know where we're going to put them. Can't take them anywhere. So I said, I'm not going to do that right now. I'm going to do things that I enjoy doing. I mean, a lot of people say they want to run, they want to do sports. I mean, now they say you can play, I'm a tennis player, you can play singles. Well, no courts in New York City are open, but you have to wear a mask. And so, also, I think a great stress for people is they go for a walk and they're wearing a mask, but they see other people not wearing a mask. So should they say something to people, or should they just let it go?
So I would just come back to that idea of what's within my control and what's not in my control. And I would put my behavior within my control and probably other people's behavior outside of my control. So certainly if I see someone not wearing a mask, I might notice the emotion of maybe fear or anger or maybe disgust. All of those emotions are communicating something to me. In fact, we have disgust for a reason. It makes us move away from something that we think could contaminate us. Fear also makes us move away. So I would act on those emotions of disgust and fear and actually just move away from the person. I wouldn't act on anger, right? I could be self-righteous and think I'm going to tell this person what to do. And I don't know how effective that is, right? Because then I'm actually bringing myself closer to the person. If I'm really interested in my own safety, I'm going to move away from the person and recognize that that person's behavior is beyond my control.
So how do you give perspective to children?
Yeah, that's such a great question.
Yeah.
So with children, there's a lot we can say here. I'd say the first thing is to take care of yourself and to model coping. So social learning theory means that children do what they see. So when you model, and by model I mean display behaviors in line with taking care of yourself, when you practice self-care, when you exercise, when you meditate, you eat well, you connect with friends, you're communicating to your children that is important. I'd also recommend probably limiting access to news for children. And you can ask them youth directly how they're feeling if they have questions. It's probably better for them to come to you with their concerns versus them turning on Google or getting stuck on concerns they may see in social media. I'd also say to normalize anxiety, right? We all feel anxious right now. Anxiety is the body's alarm system. It alerts us to danger, to threat. And so it makes sense, just as we said at the beginning of this Zoom, that our anxiety response should be going off right now. It makes sense to feel anxious now. And remember that anxiety can cause physiological symptoms like heart racing, trouble breathing, headaches, stomach aches. These symptoms are certainly unpleasant. However, they do not necessarily indicate danger. They're safe and will pass with time. So naming feelings, helping children to label emotions, including anxiety, is the first step to regulate emotions. I'd also say validation is very important. And what is validation? It's to communicate that a person's response makes sense. So what does that look like? So with a child, you could invalidate a child by saying, "You're young, you're safe, why are you so nervous? You'll be fine." That's invalidating. Now, what would be validating? Something more along the lines of, "I understand this is tough. You've never experienced anything like this before. It makes sense to feel a bit nervous about everything going on." So validation is really, really key. You want to eliminate responses along the lines of, "You're overreacting, just relax, there's no reason to be upset." That actually makes emotions get bigger. You want to encourage activity. So of course, kids can also feel lethargic, fatigued, less motivated. They feel cooped up at home. So maybe activities like taking a walk, doing jumping jacks, jumping rope, dancing, playing tag, whatever you can come up with. And also going back to our cognitive skills, those certainly work with the kids as well. So shifting perspective, recognizing this is temporary. Humans are resilient. There's many things that there are many, including past pandemics, have been overcome. And also remind kids of the things that they can control. Encourage them to socialize in an appropriate way, whether that's playing games with friends or playing games with family. And just maintaining a sense of normalcy and structure. That's very important for children. So consistent wake up and bedtimes, typical activities as much as possible. So if their band practice is meeting over Zoom, I would certainly encourage from that. Getting input from kids too, giving them a sense of control. So do you want to FaceTime grandma? Do you want to go for a walk outside? I think these are all ideas that can certainly be helpful for kids. And when anxiety is really, really high, you can encourage kids to maybe splash their face with ice water. In fact, if you fill a bowl with ice water and you dunk your head in the bowl, that actually tricks your body to think that you're underwater and triggers the dive response, which actually slows down the heart rate and slows down intense anxiety.
So should you do that to a boyfriend or girlfriend, or are they going to think you're trying to drown them?
Well, this is something I'd recommend you do for yourself, and you could ask your child if it's something they want to do. I think it's important to also ask people for what they need. How can you support them? Because so often we might think we know how to support someone, and in fact, someone's just looking for maybe validation, and we're trying to solve a problem when all they really want is to be heard. So I'd say with kids and with all family members, it's really important to say, how can I support you? How can I help you? Versus telling someone what to do.
Okay, so I'm going to ask one more question, and then I'm going to open up to Q&A. So if you have a question, please put it in the Q&A box. I see there are 2 there, and I have some that were submitted in advance. So I will get to all of them, I promise. So please put your questions in. So the last question is, this is a good relationship tester. And I have a lot of friends calling me and said, you're very lucky living alone. I said, really? He said, yes. You know, my boyfriend or girlfriend or spouse is driving me nuts. And they argue about going out, who's doing more in the house, who's doing less, who's supervising the kids. So are you getting calls like that? Be honest.
To clarify, I have patients. I'm not fielding calls. I have patients that I see sort of continually.
Okay. Is that a concern they bring up?
Certain relationship stressors are a concern that are brought up, and usually what can be most helpful here is to think about what does a person really need and what can be validated. So often relationship conflicts come about because people jump to problem solving or telling another person what they think they should do. Validation, which is to communicate that how another person is feeling makes sense, creates so much more space to talk about problems. So certainly looking for the kernel of truth in another person's perspective to normalize why your partner is feeling the way that they're feeling can certainly go a long way.
So I have a question. I'm interested in Dr. Cohen's view of stay-at-home orders and other COVID-related policies in light of all the mental health challenges that they cause.
So stay-at-home orders, yeah. So of course, there's a lot of factors at play here, and different people are at varying degrees of risk for COVID or for complications from COVID. And so I would say the best recommendation is for each individual to consult with their doctor and figure out what makes the most sense for them. And a healthcare professional can help you weigh mental health concerns as well as underlying conditions and look at what would be the best plan for you.
Okay, and there's a follow-up question. First of all, do you feel that these policies are warranted? Though it may not be helpful for physical health, though it may be helpful for physical health, They're significantly detrimental for mental health. So I think you answered that. Another question is, my son is 21, is very quiet. Is there a good way to ask him how he's doing that will get an answer beyond fine? I mean, I know whenever I ask my kids, everything's fine until it's not.
I would say listening and what we actually call youth-led interactions are one of the most effective ways to encourage a child, a teen, or a young adult to speak. And so what does that mean? Sort of, how are you feeling? And if they say a few words, even just repeating back what they say, oh, so you're feeling just kind of blah, you're just feeling down, or you just want to do video games, whatever it is that they're saying, just simply repeating back is a very basic form of validation that then creates space for them to share more. People are often surprised that this works, and so I encourage people to try it out themselves. As soon as you go into, oh, you should go outside, you should do this, you should do that, or when an adult goes into sort of an extended monologue of their own, that sort of decreases the chances the child will speak.
Okay.
You can Google that.
We will. Okay, so someone asked, is there a danger in getting comfortable with uncertainty? If yes, please elaborate. I'm not quite sure I understand that question, but.
Well, we haven't really talked that much about uncertainty, so maybe this is a good prompt to do that. And so I guess I'll say that anxiety is certainly triggered by uncertain and uncontrollable situations. And so perhaps there's something to be said to practice tolerating uncertainty. Uncertainty can be very uncomfortable, which leads many people to become attached to specific outcomes. And that's sort of a way of trying to control the uncontrollable. So I would say, let go of attachment to specific outcomes and be willing to tolerate uncertainty. So how do you actually do that? Well, one way to tolerate uncertainty is to accept what anxiety feels like in the body. So there's actually a sensation. So if you're mindful and if you pay attention, when you're feeling anxious, when you're feeling uncertain, there's some sensation in your body. It could be in your chest, it could be somewhere else. It's that sensation and that discomfort that motivates people to act. And if you're able to get in touch with that sensation and to observe the urge and be willing to feel that urge, that I think is what I would call willingness. And that's the willingness that's needed to cope with uncertainty. That creates the space for you to choose how you'd like to act versus simply reacting.
Okay, so here's a practical question. What can I do for my 27-year-old daughter whose roommate is a nurse and she just tested positive for COVID-19? My daughter works all day in her bedroom and now can't leave the room because her roommate is always in the living room watching the only TV.
Yeah, so I think the first question here that I would ask is, what does your 27-year-old want? Have we asked the 27-year-old, hey, how can I help you?
Right.
Often we find parents have an idea of what they want the 27-year-old to do, although that might not line up with what the 27-year-old wants. So I would say to go to the 27-year-old and say, hey, this is a really stressful situation. How can I be helpful to you? And you might get an answer that is, I'm fine. And then I would say to tolerate that answer. If that 27-year-old says, hey, I wish I didn't have to live here, could I live somewhere else? If you have a spare room in your house, then offer that room. So I would say asking that person for what they need.
Okay. Another question was, I just graduated from a wonderful science writing program. Now I'm searching for a full-time plan or job, since my goal of writing for a university is on hold with hiring freezes. So the real question is, do you have resilience tips?
Yeah, so I would say to be mindful that anxious minds tend to focus on negative and threatening information. For instance, this person is saying that there's hiring freezes. Yes, there are hiring freezes, and also that is not necessarily true across the board. When we're anxious, we pay attention to the negative. So I would say remember to also pay attention to positive information, such as places that may be hiring, and just to notice if you're dwelling on what worst case scenarios and to remind yourself that humans are in fact resilient.
I guess, how resilient are humans? I mean, okay, let's say this goes on another year. What's going to happen? Do you have any idea? I mean, do you think people are just going to, can people take social isolation for a year? I know there are people in solitary confinement, but
Yeah, so on a personal note,
we're seeing rebellions, right? We're seeing people rebelling, like in others, people are rebelling, saying, you know, we can't be locked down forever. In Michigan, there were people were armed and going into the Capitol building. So there is people are getting, people want to go out. So
that's true. People do want to go out.
Okay, and it's summer. It's Memorial Day weekend. Someone said, "What am I doing Memorial Day weekend?" I said, "Well, nothing really." So, how the longer this goes on, can you project what will happen?
So I'll share that my mother has a cousin who's 100 years old, and she was born during the last pandemic. And Facebook did this video about her. You can probably Google it, Facebook New Mothers Pandemic. And so she sort of says, I know that we can get through this. When I was born, I was in a stay-at-home for many, many years, and humans are resilient, and we came out, she and her mother came out of it, and then they came out into a new world.
So I wrote an article about uncertainty, and my editor's assumption was that we're living the most anxious age in history. So I spoke to a historian, and it was through Skype, and all of a sudden the screen went up, and he was in Amsterdam, and he was saying, your editor said this is the most anxious time in history. He said, I lived in Amsterdam during the Nazi occupation. I didn't know if I was going to get shot. Each day, I didn't know if I was going to get shot or not. This is actually, I would say before the pandemic, this has been like historically one of the least anxious times in history. Countries are safer. It's not like New York City of Death Wish in the 70s. Subways are safe to go on, basically. And, there's less crime throughout Europe and the world. And now all of a sudden we have a much more anxious world. And so, I mean, is it just living day by day and just living one day at a time? And we'll see, because that's all you can really do.
Yeah, maybe let's think about anxiety from an evolutionary perspective, right? So humans have a very elaborate fear structure in the brain. We have the limbic system, we have an amygdala. And so why is that? Well, if you think about it, early humans did not live in homes or apartments. They had to be very vigilant of predators. An animal, they could be walking through the forest, and a predator a tiger could come, and they'd have to be super alert and be ready to run away. And so as modern day humans, we still have this very elaborate fear response. However, threat nowadays is more often psychological than actual physical. So often our brain is constantly scanning for threat and picking up on threats that aren't necessarily quite as intense as they were for early humans. So I think certainly, yeah, in the trajectory of time, there's less threats nowadays than there were, and there still are threats, and that's why we have anxiety, and that's the anxiety that motivates us to stay at home and to take steps to make us stay safe. The other thing I'll just add is with some of these questions, if you're finding that you really can sleep, you want to know that sustained anxiety, insomnia, that's weakening your immune system. If you're unable to stop worrying, then you're putting yourself in a state of heightened stress, and it's probably a time to seek professional help. And so I would recommend asking your doctor or your insurance company for a referral to a therapist, probably a referral to a cognitive behavior therapist, because that is the therapy that has the most support for the treatment of anxiety. As we mentioned earlier, this teaches us how to replace anxious thoughts and behaviors with more helpful ways of coping. So if you really are finding that you are significantly impaired, it's time to reach out to your doctor, to your insurance company, and seek help. And many therapists are offering virtual help, so you can access that resource from your home.
What do you do for children who are really anxious, who probably don't have the, you know, can they do cognitive behavioral therapy also?
Absolutely, yeah. Children can do cognitive behavioral therapy. In fact, at Columbia, we have a whole clinic devoted to CBT for anxious children. In fact, it's a very, very effective treatment for anxiety in youth.
And so at what age does that start? I mean, you can't do it with a 2-year-old, so.
So there's play therapy for very, very young children.
Okay.
And then 5, 6, 7, yeah, you can start to use other techniques.
So why don't you explain what is cognitive behavioral therapy?
Yeah, so cognitive behavioral therapy helps us to understand our thoughts, our feelings, and our behaviors, the interaction between the three of them. So if I'm having the thought, I'm going to get sick with COVID and die, if I believe that thought, then how am I going to feel? Probably very anxious. And then what behavior am I going to engage in? I'm probably going to avoid and stay at home. Now, the thing is, in this scenario, in the early days of COVID, that type of thought, I could get COVID and die, might fit the facts, and it might actually make sense to feel anxious and stay at home. And we might not want to change anything. However, let's take a different scenario. Let's say that we have a party to go to, and this is either before COVID or after COVID, and we're having a thought, nobody at the party is going to like me, and so you're feeling really anxious, and then you avoid the party. The truth of the matter is, people at the party might not love you. They're probably not going to kill you either. So you learn how to evaluate the thought that you have that leads you to fear the party, to come up with a more accurate thought, which is, I might not have the best time, I could have an okay time. And you realize that it's not as scary as you think it is, and you go ahead and change your behavior of avoiding to approaching. And that tends to reduce the anxiety. I'll give one more example, actually. So if you've ever known someone who's afraid of water, they have the thought, water's dangerous, water's scary. The more they act on that thought, they avoid water. The more they avoid water, the bigger and bigger the fear gets. So cognitive behavior therapy teaches you to change the thought and to approach. We don't throw you in the deep end right away, but we encourage you to begin by dipping a toe in the pool and going in further and further. And then that actually leads to what we call habituation, which means your fear of water decreases.
So I have a friend in France who, and they had France had very strict controls. You had if you wanted to go out, you had to print out a form from the government internet site and saying where you're going, and it has your name and address on it, because you can only be 1 kilometer from your house. And I'm saying, I'm going to the drugstore, I'm going to the grocery store, or I'm going for my daily walk. If you're found 10 kilometers from your house, you would get a 1,500 euro fine, and you couldn't negotiate it or talk your way out of it. And so my friend said, and this ended May 15th, so now they can go 10,000 kilometers. And he said, I really enjoyed this time. He said, I read books. I didn't have to deal with my children. I didn't have to deal with all the other obligations in my life. So there's some people, kind of like Larry David, who has a public service announcement for the state of California, which says, this is the opportunity of a lifetime. The government is telling you to stay home, sit in your couch and watch TV. I like that. So are there some people who think this is a nice little pause in their life?
Certainly, and actually that's a great demonstration of cognitive reframing, right? Because that illustrates the way that we're thinking about impacts how we feel. So if I'm having the thought, hey, I get to stay home and that could be really cool, I'm going to feel happy. Versus if I'm having the thought, this sucks, this is the worst ever, the government sucks, then I'm going to feel angry. So you've kind of just illustrated how by changing your thinking, you can change the way you feel.
Sounds like the Beatles song, Oh, That Magic Feeling, Nowhere to Go. Yeah, so, all right, so here's a question. Do you fear lasting post-pandemic mental health issues? If so, what might they possibly expect?
Yeah, I certainly do think we'll see lasting post-pandemic mental health issues among many people, certainly among our first responders, I could imagine that we'll see PTSD. 1/3 of people who are exposed to a traumatic event go on to experience PTSD. And what is it that leads one person to develop PTSD and not another person? Well, it's thought that some type of suppression, so not talking about what was experienced, can actually lead to the development of clinical symptoms. So what is the antidote? It's to be able to talk about our thoughts and our feelings. That in itself, that processing of emotions in itself can be really helpful in terms of preventing the development of other clinical problems like PTSD. Among people who aren't first responders, certainly stressors like unemployment and the downturn in the economy could lead to a range of mental health problems. Often it's useful though to think about everybody has a biological vulnerability, and everybody sort of comes into this with something, and then that interacts with a stressor. It's a little bit like nature versus nurture. Well, it's probably both. So we all have an innate nature, and then there's this environment, this pandemic that's happening around us, and then it's that interaction that kind of leads to what happens next. And so it sort of looks different for each person based on what they're coming in to this with.
Okay, so next question is, how does one reconcile being told to stay at home for upwards of 10 weeks and now being allowed to participate in society as it opens up? I feel as though I've been training myself to be afraid of this disease through isolation, and now it seems we're expected to desensitize to the fear a bit as we reopen. Any suggestions on tips to working through this transition?
Yeah, so that's another great question that's sort of about thoughts, and are our thoughts accurate, right? So we were sort of told, hey, this is dangerous, stay home. And now it's a little bit like, hey, you can come out. So I think, again, consulting with your healthcare provider to look at your unique constellation of risk factors to try to figure out what is the most effective behavior and what is an accurate thought for you. So for some people and in some areas, there may be more pros for that person to leave their home, perhaps in a cautious, socially distanced way. Whereas for another person, maybe an older adult living in a densely populated area, there may be less reason for that person to risk going out.
Okay, so let's say, the first wave is over, and then a second wave comes back, which is what they're saying is going to happen. How do you deal with the, it's kind of like, depression goes away whether you treat it or not, but it does come back. So how do you deal with that? Maybe that's true, maybe not. But so how do you deal with the fact that, again, it's, flu season is going to start, they're going to start giving out flu shots in September. And I predict that a lot of people are going to get flu shots this year and not worry that they're, a lot of people tell me, I don't get flu shots because it always gives me the flu. I think people are going to be lining up for flu shots. I don't hear any anti-vaccination talk about this. People want a vaccine for this COVID-19. So how do people deal with the fact that, okay, maybe the summer things will loosen up, but then comes the fall, it's time for your flu shot. I mean, I know there's certain schools that are going to open in August and they close at Thanksgiving. So the flu season starts getting December, January, February. COVID-19 also comes back, comes in, winter. So how do people deal with the fact that they're going to have freedom, but may have to go back home again?
So, and I presume this is, a question for, not a medical professional whose job it is to plan ahead for the fall, but for those, right? So I think this is, again, really being mindful of what is in our control and remembering that life is lived in this moment. The past is over, the future has yet to happen. And so anxiety helps us to problem solve and to plan. However, too much anxiety or ineffective anxiety leads us to worry. And so in this scenario, I'm not necessarily, I guess I would ask, are there steps that can be taken now that are problem solving or planning? And if the answer to that is no, then it seems like what's happening is just a sort of worry of what if this happens and what will the fall be like. And so that's when anxiety starts to look a little bit more clinical and a little bit less helpful. And then when you want to think about maybe reaching out for help, if that is something that you're finding yourself grappling with.
So this is going to be my last question. So what can our leaders say to us that are going to make, that can make us feel, we look to our politicians, we look to our doctors, we look to, and say to us, you're going to get through this. But what's the message that we're all looking for during this time of uncertainty?
I think we're looking for transparency, and we're looking to our leaders to display the behaviors that would be helpful. So when leaders are not wearing masks, that decreases the likelihood of other people wearing masks. And I think we're looking for accurate information.
Okay. So any last words you want to say to people to reassure them, and to also, why don't you give a list of resources again?
Yeah, certainly. I would say it's normal to be anxious, and anxiety, like all emotions, has a function. And so if anxiety is motivating you to take appropriate steps, like practicing social distancing, washing your hand, wearing a mask, then anxiety is doing its job. However, if you are losing a significant amount of sleep, if you're unable to stop worrying, you're having worries around things that cannot be problem solved, cannot be planned, things that are beyond the realm of your control, then you're really likely in a heightened state of stress. And I would say then you really have to know it's time to seek professional help. And cognitive behavior therapy is the gold standard treatment for anxiety, teaches us how to replace anxious thoughts and behaviors with more helpful ways of coping. So I would encourage you to ask your primary care provider or insurance company for a referral to a therapist who offers cognitive behavior therapy. If you're finding that you're not so distressed, and you maybe think that you can manage this with a little bit of self-help, so you're not losing significant sleep, you don't have all those symptoms I just mentioned, you're just feeling a little anxious, then you might want to try something like Headspace, the COVID Coach app. Also, in terms of clinical resources, I believe, David, you had mentioned that NYC has the Thrive website, so that could be helpful for people living in New York.
Okay, I think for people living throughout the country, I would go to the government website and Google mental health. I think there's plenty of people offering this. And the other question, okay, so one last question I thought about, because should you get tested for antibodies? That question came popping up, because we're not 100% certain that the tests are accurate. So.
Yes, I think, I can just say, as a psychologist, as a scientist, what we know is that there's not enough data. And so we don't actually know how helpful those tests are. There's questions around what does having the antibodies actually mean. And so I think that's just an area where we need more data.
And so someone just asked me, are you taking new patients?
Am I taking new patients? So you can certainly call Columbia Intake, and I can give the number. And I have maybe a little bit of availability. And if I'm not able to see them, then hopefully someone else is. Let me just give you that number.
Okay.
So that is 212-305-6001. Again, 212-305-6001.
Okay, well, this is Dr. Jeffrey Cohen. I'm David Levine. I want to thank Joe Bonner, who is behind the scenes, but he makes all our Zoom interviews possible. He's my SWINY co-chair. And thank you very much for your time. And I think we learned a lot. So,
Yeah, I appreciate it.
Be safe, and be calm and stay at home and watch TV and enjoy yourself if you can. Okay.
Thank
Good night.
you.
Good night.